So let's say you have had this laundry list of symptoms that you are trying to get rid of, right? So you've been kind of burned out, kind of anxious, not sleeping very well. Maybe your muscles are tight, and you've tried a wide variety of over-the-counter supplements, and it's just not enough. Well, what can you do from there? Well, there's some great prescription medications that we compound, a lot of compounding pharmacies make, that work directly on specific areas of the brain to help calm the brain, but also reduce inflammation throughout the body. So one of my favorites is called Synapsin, and it's a combination of several medications, but it is a really easy to use nasal spray. The hardest part is it's got to be kept in the fridge. So you got to remember to get it out and use it. But that's really easy to do when you get up in the morning before you go to bed. And you can always ask for a second smaller bottle to maybe keep at work or something. So what Synapsin does, it's a combination of a derivative of ginseng and also a derivative of a B vitamin. And it helps to kind of mellow out the electronic impulses in the brain, but it's combined with a little bit of B12. And with that, we can see even more neuronal or nerve proper firing. Let's just call it proper firing. And with that, we see a reduction of inflammation. So people have reported that using Synapsin, they feel clearer, they have less fogginess, they're able to find their words quicker, and they actually feel a little bit more energy. And again, it's a very simple nasal spray. We show you how to use it. This is a medication that has been used by the NFL for a wide variety of traumatic brain injury because, you know, when those guys are going at it, even in practice, right, they're head to head all the time, and they tend to have several concussions and they're just kind of, you know, jostling their noggin quite a bit. So this was a medication developed by scientists and also some clinical pharmacists to help decrease inflammation in the brain. It's one of my favorites because it's so easy to use. It's not expensive. And if you need help talking to your physician about it, let us know. We actually have a write-up on that. You can either call us or email us, and we'd be happy to send that over. It's a simple piece of paper you can take to your doctor and just say, this is something I'd really like to try. So one of my other favorites is a natural hormone that we've used over time for a wide variety of reasons, and it's called oxytocin. So oxytocin is also known as a cuddle hormone. So it's very much produced when a new baby is born and put on mom's chest, and that bond that you begin to form, that sense of warmth and connection, that is oxytocin. And it's released in the brain and then traveled throughout the body. It is one of the best hormones that we see to help reduce grief, to help reduce depression, and also to help even work with autism. Because in autism, sometimes people do not have that sense of connection. They don't have the verbal skills in some situations, or even the visual skills to make contact. But with oxytocin, it's very easily prescribed. Again, it is a prescription medication. We make that in a nasal spray, but we can also make it in a capsule or in a gel. We could also use it for vaginal health. We can use it for anorgasmia, and it works really well in men and women for various reasons. So men make oxytocin as well. They just don't make as much as women do. But what we have found with time, and there's a few scientific studies that have been written about oxytocin, is that it is fairly safe. We do have to be careful about cardiac health because it does constrict blood vessels. So again, it's something to talk to your pharmacist about, and definitely to talk to your physician about. If you need help with how to talk to your doctor about using oxytocin, whether it's right for you or not, let us know. We have handouts that go along with that as well. And you can either email us or you can give us a call. We'd be happy to provide that for you.